Good evening everyone, how are you? Hope you are doing good. Today I am going to talk about one of the important topic, that is obesity management in patients with diabetes according to AACE guidelines. Let's go into the topic. The diagnosis and evaluation of obesity or adiposity based chronic disease ABCD in persons with prediabetes, type 1 diabetes or type 2 diabetes. They should include both anthropometric and clinical components. The anthropometric evaluation should include BMI. Waist circumference should be measured as a marker of cardiometabolic disease risk. Most adults, a BMI in the range of 25 to 29.9 kg per meter square is categorized as overweight, and BMI more than 30 kg per meter square is categorized as obese. And waist circumference threshold values are greater than 102 cm for men and greater than 88 cm for women. These values differ for the Asian population. The clinical evaluation of persons with both prediabetes, type 1 or type 2 diabetes, and obesity. They should assess the presence and severity of weight-related complications, includes cardiometabolic complications such as dyslipidemia, hypertension, non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, cardiovascular disease, heart failure, and diabetic kidney disease. Biomechanical complications like obstructive sleep apnea, osteoarthritis, gastroesophageal reflux disease, and urinary incontinence. Abnormalities involving sex steroids such as infertility, polycystic ovarian syndrome, and hypogonadism. Impact on psychological disorders and quality of life. As per the recommendation, patients with type 2 diabetes and obesity should be counseled for weight loss intervention, which will improve their glycemic control as well as complications related to obesity. The target for weight loss should be more than 5 to 10% of baseline body weight. This can be achieved with lifestyle interventions, a calorie deficit diet, daily physical activity, regular exercise for more than 150 minutes a week, and behavioral health practices. The Mediterranean, low fat, low carbohydrate, very low carbohydrate, vegetarian, vegan, and DASH diets are recommended, safe and effective for short-term weight loss. Only the Mediterranean diet has evidence of long-term risk reduction for cardiovascular disease events and mortality amongst all other diets. Patients with type 2 diabetes and obesity with BMI greater than 27 kg per meter square should be treated with diabetic medications associated with weight loss like GLP-1 analogs and SGLT2 inhibitors. In addition, for persons with prediabetes, type 1 or type 2 diabetes who have obesity, consider FDA-approved weight loss medications as an adjunct to lifestyle intervention to achieve lowering of HbA1c, reduction of cardiovascular disease risk factors, treatment or prevention of other ABCD complications, and improvement in the quality of life. A person with a BMI of greater than 35 kg per meter square and one or more severe obesity-related complications which is remediable by weight loss, which includes type 2 diabetes, higher risk for diabetes including insulin resistance, prediabetes, metabolic syndrome, poorly controlled hypertension, NAFLD or NASH, obstructive sleep apnea, osteoarthritis of the knee or hip, and urinary stress incontinence, they should be considered for a bariatric procedure. As per the recommendation, diabetes patient with a BMI of 30 to 34.9 kg per meter square with inadequate glycemic control despite optimal lifestyle intervention and medications, they should be considered for bariatric procedure. Thank you so much for your kind attention, and kindly share my lecture to your friends.